Oral yeast infection, also called oral candidiasis or oral thrush, is an infection caused by the fungus Candida albicans, which causes the formation of white surfaces on the oral mucosa. The Candida albicans fungus is part of the normal microbiota of the mouth and fulfills important functions in our day-to-day. For candidiasis to occur, there must be an overgrowth of the Candida population. Anyone can get an oral thrush infection, but in most cases, the infection occurs in people with weak immune systems, such as babies, the elderly, and people with immune diseases. Oral thrush occurs when there is an imbalance of the microbiota in the oral cavity, allowing the excessive growth of Candida albicans. Among the causes of oral yeast infection we have systemic diseases that affect the immune system, such as diabetes, leukemia, HIV or AIDS, xerostomia or dry mouth, some drugs that suppress the immune system, such as chemotherapy and steroids, people who have received an organ transplant and who are under immunosuppressive therapy, very young people such as babies, or very old people since their immune systems are more vulnerable. Usage of antibiotics, since these drugs produce an imbalance in the population of microorganisms that make up the normal microbiota of the mouth. Prolonged use of medicated mouth rinses, smoking, and incorrect cleaning of dentures. The typical clinical characteristic of oral candidiasis is the formation of whitish patches, with a creamy or velvety texture on the oral mucosa, mainly on the tongue and cheeks, although it can also appear on the palate and gums. When examining these patches, the dentist may notice red, bleeding tissue under them. The patient perceives a sensation of having a dry and pasty mouth, itching or burning, and pain when swallowing. In some cases, the patient could have bad breath due to bleeding caused by the white patches. Depending on the severity of the symptoms and the appearance of the lesions, oral candidiasis can be classified into 3 types. 1. Pseudomembranous candidiasis. It is the mildest of all. It does not cause symptoms or any type of discomfort. It simply consists of the formation of whitish plaques that can be removed with gauze. 2. Erythematous candidiasis. This is the most frequent and appears mainly due to the use of antibiotics. It is characterized by the formation of whitish plaques surrounded by reddish and shiny tissue caused by inflammation of the mucosa. This type of candidiasis can cause a burning or itching sensation. And 3. Hyperplastic candidiasis. This type is very rare. It usually appears on the inside of the cheeks, near the corner of the mouth, and usually causes angular cheilitis or cold sores. In this type of candidiasis, the whitish plaques do not come off easily. In most cases, oral candidiasis disappears on its own once the balance of the oral microbiota is restored. One way to speed up the process is by consuming probiotics, such as natural unsweetened yogurt. In cases where the thrush infection is moderate or severe and is causing symptoms, the dentist should prescribe antifungal medications for oral yeast infection to reduce the amount of Candida albicans in the mouth. These can be mouthwashes, creams, gels, ointments, or pills. The antifungal medications for oral thrush are nystatin, fluconazole, and clotrimazole. These are applied topically to the oral mucosa and rapidly decrease the amount of Candida albicans. There is a wide variety of these medications, and it should be the dentist who determines which one is best suited for each particular case. As additional information, the thrush oral tablet that consists of just 1 dose is very useful in vaginal thrush, but is not ideal for oral thrush, so oral medication for yeast infection with said tablet won't be effective. For oral medication for yeast infection to be effective, you will need to take smaller doses of medicine for thrush, ideally fluconazole, for at least 7 days. You can also opt for a medicated mouthwash. The optimal mouthwash for treating oral thrush is nystatin mouthwash, which is a highly effective antifungal medication. We must emphasize that this medicated mouthwash must be used for a certain time. Once the Candida infection disappears, its use must come to an end, since it could affect other microorganisms in the long term and create another imbalance of the normal microbiota. You can also use over-the-counter creams for oral thrush that contain nystatin or fluconazole, and it is usually enough to treat mild cases. However, keep in mind that if the infection persists, you might need oral medication for yeast infection, and that requires a medical prescription. There are also natural alternatives to treating oral thrush. For example, you can include probiotic foods in your diet to help restore the balance of oral microbiota. Some of the best probiotics for oral thrush are natural, sugar-free yogurts or kombucha. You can use apple cider vinegar for oral yeast infection by diluting a teaspoon of vinegar in a glass of water, and then using it as a mouthwash. And lastly, you can apply coconut oil or tea tree oil on your oral mucosa. This will relieve the symptoms and will reduce Candida due to the antifungal properties of these oils. When it comes to babies, candidiasis is quite common because their immune systems are still immature and are not able to regulate the growth of Candida albicans. Fortunately, this can be fixed quickly. Treatment for oral thrush in kids involves applying nystatin gels or ointments to both oral lesions and the diaper rash area. The baby's mother may need to apply some ointment to her nipples if Candida is detected. Clinically, whitish areas can be seen in the baby's mouth, similar to coagulated milk, so the infection may go unnoticed. However, it is very likely that a baby with thrush will not want to feed and will be irritable. It is also likely that a diaper rash occurs simultaneously with oral thrush. Finally, we must clarify that oral yeast infection is not contagious. The Candida albicans fungus is naturally present in everyone's mouth, and coming into contact with it will not cause an infection. For oral candidiasis to occur, there must be an overgrowth of this fungus, and this only occurs in patients with weakened immune systems or after taking antibiotics. Candidiasis may clear up on its own in about 15 to 20 days, but it may heal faster if you get antifungal treatment. This is it for today's video. Thanks for watching, like, and subscribe for future oral health videos. Till the next time.